regarding 19 millimeters of distance. It's recommended that distance is more than 10 centimeters or 100 millimeters between different point of stimulation. Not matter which nerve, not matter which muscle, is the best to have distance more than 100 millimeters. But it's not possible to have this distance every time because of the short limbs. Is it clear? Awesome. Okay, let's go to another technique. It's a needle EMG, or it's a QEMG, or it's quantitative EMG. You can see this technique on the toolbar here, quantitative EMG. To create a new test for this technique, click on the icon. Let's use my favorite way to choose the muscle. Okay, and let's choose upper limbs girdle and right deltoides muscle. Okay, new test has been created. Needle EMG is performed with the needles, with concentric needles electrode, which is inserted into the patient muscle. And with the help of this needle, we can estimate condition of muscle of patient. We've already known that there is different abnormalities may exist in muscle, in myopathic lesion, or in neurogenic lesion. So, with the help of concentric needle electrode and QEMG test, we can estimate the muscle condition. As you can see, QEMG test consists of 3 different techniques. The first one is a spontaneous activity. Spontaneous activity is recorded during muscle relaxed. MAP, motor unit action potentials. Motor unit action potentials is extracted from signal during the lower force, lower intensity of contraction, slight contraction. And the last technique is interference pattern. Interference pattern should be recorded with a modern or with a straight contraction of muscle. Okay? I recommend you to start your examination with spontaneous activity. You can pick up this technique with mouse button or with hot button on the device, F2 button. First of all, need to put the ground electrode on my patient's limb. I tend to have ground electrode to be much closer to the muscle where I will insert the needle. Okay. Now I'm gonna prepare adapter for needle electrode. We can see that in this type of test we will use first channel. So I plug in the adapter into the first channel of amplifier. Okay. Entangle the wires. Stimulator doesn't need any longer. You can see that there is no settings for electrical stimulator because we won't use electrical stimulator. And now I need to put on gloves because this technique is invasive. And I should care about my patient. I don't want to hurt them. After then, I will use issue with alcohol prepare the patient skin. Okay, this one. Each muscle has its own point where the needle should be inserted. For the deltoid muscle, it's below joint, approximately on the forefinger breadth. Okay, now I open a needle and plug the adapter into the needle. After that, I start recording. Here we can see signal from the needle tip. You see a huge noise because needle isn't into the muscle. Okay, and I'm ready to insert the needle into patient muscle. Relax your muscle, entirely relax your muscle, and I'm ready to insert the needle. Okay. Now we can see full baseline without any noise. After I inserted needle into the muscle, you may see insertional activity on the recording. That's the reason why I first started recording, and then I insert the needle. If needle is really in muscle, you will see insertional activity. But if needle isn't in muscle, you will see nothing. Okay, let's estimate spontaneous activity. When muscle relaxed, in normal muscle, we won't see any activity. I move needle to estimate spontaneous activity in different point. Here, as you can see, insertional activity. Relax your muscle. You can see a forest discharge. It's due to patient muscle isn't relaxed. Yeah, we have in different ways have to distinguish voluntary potentials from spontaneous one, but sometimes it may be challenging for the doctor. Okay, press OK button to save the data. Start recording one more time. Move needle to the different point. Let's estimate spontaneous activity in this point. Here we can see how muscle contracts, relax. And I press OK. The last 7 seconds will be saved in Car Viewer. Here we can see that we have two different traces from two different points in muscle, and you should estimate spontaneous activity at least into 4 points of muscle. But it's just an example. So let's go ahead. Let's go to the next test. It's test for the motor unit action potentials. I can switch to this test with mouse, clicking here. I just click F3 button on the device. Okay. Here you can see another window, this window for the motor unit action potentials. It's signed here. And in this test, we will ask patient slightly contract his muscle, slightly contract his deltoid muscle to collect some motor unit action potentials. Pressing recording button, we'll see a window with acquisition. And this window is split into 2 different parts. In the upper half, we can see signal from the needle. Due to muscle relaxed, we see pure baseline. But if patient contracts his muscle, you can see here how muscle works. On the lower half, we see preview. We see preview for the motor unit action potentials, which online extracted from line as the upper trace. Reached? Oh. Okay. Now we will ask patient to slightly contract his muscle. A bit less. Okay, this one. And look for the point where we see a good motor unit action potentials. This looks like this one is good, and I press averaging button. Patient keep his muscle contract for 4 seconds, and after recording is done, we can let patient relax his muscle. Here we can see that we collected 3 motor unit potentials. This one, the best, and 2 of them have a bad quality. Have to recognize which one is a good and which one is a bad. First of all, it's the shape of motor unit action potential. The shape should be sharp, the rise time should be low, and the second way is the sound. The sound of motor unit action potential should be sharp and loud as well. And the last way is to look at the indicator near the motor unit action potential. Green one means that maps have appropriate shape and sound. It means that it's a good waveform, and red one means that it isn't appropriate potentials. You can see bigger rise time. It looks like these potentials are far away from needle tip. And now we need to decide which amps we will include into analysis. I recommend you include only a good motor unit action potentials to estimate data properly. So clicking on motor unit action potentials with right mouse button, I can include or exclude potentials in the adding for analysis. But there is one more way how to include or exclude motor unit potentials is numpad. Pressing one button on my keyboard, I include or exclude potential. Okay. From this point, I will take only the second motor unit action potential. Press OK, and we see that only one potential was added into analysis. Now we have to collect a bit more action potentials. Actually, we need to have at least 20 potentials to estimate the data. At least 20 different potentials from different muscle points. To record different motor unit action potential, I start recording again, and I move needle at least 5 or 1 millimeters deeper or superficially. Or I can change the direction of needle. Why is it's need to move needle up to 10 millimeters? Because 5 or 10 millimeters It's an area of motor unit. Area depends on muscle. In some muscles, it's 5 millimeters. In some muscles, it's 10 millimeters. So if you move needle not enough, you will collect the same motor unit action potentials you already have. So I moved the needle and ask my patients to contract muscle one more time. Here, and move needle, looking for the best. Okay, this point, good. Let's collect the data. Okay. It seems to me that we have two good motor unit potential from this point, the first one and the fourth one. The fifth, it's up to you. It's maybe added, but it's maybe not added. It has a good shape, but it has a long raise time. Okay, let's add it. Let's add it potentials. We can exclude it after then anytime we want. Okay, save the data. Now we already have four potentials. I care about my patients, so we start to hurting him. We stopped hurting him and go ahead to another point. But in reality, in real exam, you need to have at least 20 motor unit potentials. Okay, go to the interference pattern test. Press F4 button on the device or with the mouse button interference pattern. We found out ourselves in the next test. Interference pattern is technique when we will ask our patient to contract his muscle in different force with modern force and a bit more, and after that we will ask him to do all his best. Okay, are you ready?
Yes.
Is everything okay?
Yes.
Okay, start recording. Here you can see window with acquisition. Here is no signal because muscles are relaxed. And now we ask patient to contract his muscle. Okay. Now we're ready to save the data. Here we see turn amplitude analysis and different plots which are into our normative values cloud. It's a little force of contraction. And now we should start recording one more time and should ask patient to contract his muscle with more force. Okay. Okay, now we can see, continue. Now we can see that frequency of motor unit action potentials became more. And press OK, relax. Here we can see that for this level of contraction, dots are a bit a switch on the right side of the cloud, but still in normal values. Okay, let's try to find these dots between these two different levels of contraction. Contract your muscle. Yeah, this way. Okay, and save the data. And one more recording. Please try to do all your best. Yeah, we will see full interference pattern and save the data. Okay, that's enough. Let's eject needle out of the muscle and use tissue. Okay. Thank you for your patience. I appreciate it. And data acquisition is done. Now we need to estimate data we've got. Okay. Okay, let's wait for a while. I'm still waiting for your question. Thank you. Thank you for coming. Hope everything was well. Thank you too. Okay, dear colleagues, it looks like we don't have any questions, but if you have one, you may ask them and send your questions to the support or to the email emg neurosoft.com.
So this is the end of our workshop EMG Fundamentals. Video recording of this workshop we will post on our educational platform, which we will create in the near future. So you will find this recording there. Besides, in order to make our educational courses better, we ask you to fill out the form which we will send to your email. There you can find the question about the certificate. If you need it, you should fill out this question. Thank you for your attention, and see you at the future educational courses.
Recording stopped.